Okay, we are good to go. So let's get started. So today, our presenter is going to be Crystal Funky. She is with, of course, the National Health Career Association. Crystal has been with our company for a long time and brings so much great experience in this field of medical assistance and bridging the gap with educators and employers. And she'll give herself a little bit of a self-introduction as well, because I cannot do it justice. We are going to talk about three things today, main topics: medical assistants as pillars of care transformation. We're going to talk about the expanding role of medical assistants and how it continues to evolve. And then we are also going to speak with Leanne Thorne, who is a medical assistant in the field, also with great experience and a lot of insight that we hope you'll find very helpful. So before we do that, we're going to take one poll for our audience. We want to understand who is joining us on the line today. So you should see something popping up on your screen. And we want to know, are you a medical assistant educator? Do you hire medical assistants? Are you a practicing medical assistant, a student, or other? We're going to give you about 15 more seconds. All right. Here is what the makeup of our audience looks like today. So it looks like we have a lot of medical assistant educators, and then a sprinkling of our other categories. So again, welcome everyone. We're really happy to have you. All right, with this, I'm going to hand it over to Crystal Funky.
Thank you, Stacy, and welcome everyone. I have had the opportunity over the past 10 years to collaborate with educators and employers throughout the country as it relates to the evolution of the medical assistant role. And I am very excited to share my experience throughout this conversation and provide ideas on how to empower your medical assistants to reach new heights. So throughout my 10 years, I have also had the opportunity to speak with physicians in regards to medical assistants on their care team. And the general consensus is that physicians cannot do their jobs well without highly qualified medical assistants. MAs are becoming vital assets in enhancing clinical outcomes, efficiency, and helping bring the joy back into practice for physicians. Medical assistants are starting to be labeled as the new heroes in healthcare. Despite the heroic description, there continues to be a shortage of medical assistants in the United States, primarily caused by two major obstacles. Number one, since 2014, the number of medical assistant graduates in the United States have suffered a significant decline due to school closures and overall decreased enrollments, despite the fact that the Bureau of Labor Statistics is projecting a 23% job growth. Second, there is an increase in volume of need for medical assistant graduates as clinics continue to adopt a team-based care or patient-centered care model. In this evolving model, the ratio of MA to physician is 2-to-1 or 2.5-to-1, compared to traditional staffing models of less than 1 MA per physician. The team-based care model almost doubles the MA demand in the United States. The great news is that these obstacles have created exciting opportunities for employers, educational institutions, as well as medical assistants. As Robert South said, an obstacle is often an unrecognized opportunity. I believe these opportunities are leading to the overall opportunity to empower medical assistants to reach new heights. So we will talk about opportunities for educational institutions and employers shortly, but first, I want to talk about the role of the medical assistant and how it has evolved. The emerging team model requires a fundamental shift in physician approach to care delivery. Instead of a physician trying to do everything in a 20-minute appointment, medical assistants are now empowered to perform tasks beyond what they have traditionally been accustomed to. As the industry continues to move toward a value-based care model, MA education and on-the-job training simply needs to evolve to ensure medical assistants are ready and able to work at the top of their skill set. But encouraging medicals to work at the top of their skill set does have a fundamental challenge. There's no consistent scope of practice from state to state or employer to employer. With that being said, you can see that medical assistants are expanding beyond their historically traditional responsibilities. The use of medical assistants increases efficiency in the pursuit of value-based targets and requires physicians to delegate tasks down. This is a prime example of how care transformation is empowering medical assistants to reach new heights. This increased level of responsibility is also why employers find it important to validate competencies through successful completion of an accredited certification exam. So now that we have talked about the evolution of the medical assistant or the medical assistant role, I do want to talk about how educational institutions can seize this opportunity to empower medical assistant students. It's important to teach the basics, but also very important to help students understand where the industry is headed with value-based care. The ability to be recognized as a crucial member or critical member of a care team should inspire your medical assistants to embrace this opportunity. With that being said, my number one advice as I speak to educational institutions throughout the country is place a strategic focus on your MA program. It is important to listen to employers in your community at a micro level, but it is also very important to be aware of macro level trends such as team-based care, which may not be in your backyard yet. Ensuring your students understand the shifts in patient care can give them the freedom to find jobs anywhere in the nation. Because medical assistants are expected to work at the top of their skill set, employers are either requiring certification upon hire or within 60 to 90 days after hire. A recent statistic suggests that 88% of employers require medical assistants to be certified at the time of employment or shortly after. As an educator, your students will benefit from earning a national credential prior to graduation. This will also help your students stand out from other applicants throughout their job search. So this is Jennifer. She is a single mom that just started her first job as a medical assistant. She unfortunately did not earn a certification prior to employment. She has been instructed by her employer that she will have to earn her medical assistant certification within 90 days in order to remain employed. At this point, she's trying to learn a new job, care for her family, and study for the exam while no longer being in the academic mindset. What word or words come to mind as you think about Jennifer? For me, it's stressed, scared, and overwhelmed. She has a lot riding on the fact that she has to pass this certification exam to remain employed. The good news is this scenario doesn't have to be the norm. So we're going to take an audience poll. What percentage of your students what percentage of your medical assistants experience external stressors that impact their performance? about 5 more seconds. All right, it looks like about 75%, which aligns pretty well with what I hear as I'm working in the industry as well. So some of the work that I've done, the question becomes, why do students not participate in sitting for the certification exam? Fear is one of the greatest deterrents from attempting the certification exam. I encourage all educators to use preparation resources and constant positive reinforcement in your classroom. Take time to communicate that you believe your medical assistants are able to be successful despite their own doubts. You should be able to do this with data and analytics from your certification agency as it relates to performance on preparation materials as well. And really encourage your students to get certified before leaving the program. My last piece of guidance is to understand the skills gaps your students have post-graduation. The best way to identify skills gaps is to maintain strong working relationships with employers in your area. I encourage all employers on the phone to share open and honest feedback with your educators, and vice versa. Educators, maintain a relentless pursuit of programmatic greatness by getting feedback from top employers in your area. For example, create an advisory board with the largest employers of medical assistants and consistently ask for feedback regarding your students. NHA recently conducted a national survey asking employers about the top skills gaps in medical assistants. They responded with clinical experience, patient communication, critical thinking, professionalism or soft skills, and time management. So for the last poll, what do you experience as the top skills gaps? As you're filling this out, I do encourage both educational institutions and employers to answer this question. We'll give you about 10 more seconds. That also looks like professionalism and soft skills is the top answer. That also tends to be what I experience when I'm in the field as well. So in summary, before I address the employers on the phone, recommendations for high-performing medical assistant programs include prepare and certify your students, create strong externship relationships with employers, encourage feedback through a well-designed advisory board, and coach students on professionalism, soft skills, and what to expect throughout the job search. You could also invite employers or your partnered certification agency into the classroom to speak with students as well. Now for the employers on the call. There are simple things you can do to seize the opportunity to empower medical assistants to reach new heights. One of the most common challenges from employers is that there's not enough medical assistant applicants to fulfill the number of MA job openings within an organization. There could be a real simple fix. Review your job descriptions. Do the medical assistant job descriptions clearly state acceptance of all NCCA accredited certifications, including NHA's CCMA credential? If not, make updates as soon as you can. Your job descriptions could be steering highly qualified medical assistant graduates away from applying for jobs within your organization. For reference, this is an example of all the NCCA accredited medical assistant credentials that should be listed in your job descriptions. Most employers list medical assistant credentials under the requirements section of the job posting. Having an all-inclusive list is an opportunity to limit confusion of whether or not a medical assistant should apply for a job within your organization. I also consistently hear that retention is a challenge. It is estimated that there's over 500,000 medical assistants working in the United States, with a 40% turnover of employed medical assistants on an annual basis. That is a really high cost to employers. Through our partnerships, we are finding that retention increases when employers purchase certification for their employed non-certified medical assistants and create career ladders, which we will talk about in a minute. The opportunity to invest in your medical assistants makes them feel important and valued. You can empower medical assistants to reach new heights through investing in your MAs and empowering them to do more. In addition, they are proud to earn credentials after their name. Finally, the most exciting opportunity for employers to empower medical assistants is through career laddering. Career laddering gives employers the opportunity to recruit top talent, provide professional growth, leading to enhanced retention and increased productivity while managing risk. The Vice President of Programs at the National Fund for Workforce Solutions said, "When the frontline worker is better trained and has career advancement opportunities within the organization, there is a direct correlation to improved patient care and improved patient satisfaction." So here's an example of a career ladder or career advancement opportunity. It is recommended that as a medical assistant progresses through each step, that they experience an increase in pay as well. Step number 1, obtain medical assistant certification from an accredited certification agency. This allows the employer the added benefit of ensuring quality and safety in the clinics. What we found is that the physician confidence in medical assistants also increases when medical assistants are certified. Step 2, expand the certified MA's scope of work and allow additional tasks such as scribing and health coaching. To expand on the health coaching comment, this could mean a medical assistant could continue their career as a health coach, or an MA could simply gain health coaching skills, which is an important aspect of patient panel management. It is important because nearly half of Americans suffer from chronic conditions, and 90% of patients do not adhere to their prescribed treatment plans. For example, an MA may ask a patient, "Are you taking your medications daily?" 9 out of 10 times, the patient will say yes, even when they are not. Health coaching skills is a means to teaching medical assistants to ask open-ended questions and use motivational interviewing versus yes or no questions. The World Health Organization came out with a powerful statement, which is increasing adherence may have a far greater impact on the health of the population than any specific medical treatment. This is an example of how influential health coaching can be to the population. Step 3, promote the medical assistant to a team lead role. In this role, the medical assistant can lead team huddles as well as train other medical assistants. This allows the MA to help ensure the physician is in flow and on time. From partnered employers, we have found that not only retention increases with a standardized career ladder in place, but patient satisfaction scores also tend to increase, while the burden of work for physicians decreases with the adoption of MA team leads. So finally, and before we begin the conversation with Leanne, this is a quick reminder that members of a care team have to work together, but they all have different educational backgrounds. And in summary, greatness is never completed by one person, but by a team of individuals. Before we talk to Leanne, if you have questions, then please enter them in the chat and we will answer at the end. At this time, I would like to introduce Leanne Thorne. Leanne has been working as a medical assistant for nearly 30 years and was one of IU Health's early participants in their career laddering program. I'm excited for her to share her firsthand experience. Thank you, Leanne, for being here today.
Thanks for the invitation to join.
Awesome. Well, we'll start with our first question. Can you just tell us how your role has evolved since you started at IU Health?
I started at IU Health almost 10 years ago, and we had a fairly small nephrology clinic that I worked with. And I have been able to be instrumental and help to grow that clinic. Since I've become certified and started climbing the MA career ladder at IU Health, I really can supply really excellent support to our doctors and to our patients. We've noticed an increase in our patient satisfaction scores, some months even hitting 100%, which is almost unheard of with patient satisfaction. I feel that it helps me to have greater pride and in my job by being certified. It helps me just to be able to know where to go to support my physicians and my patients. And it has also allowed me to become a go-to person and sort of a mentor in our clinic. It also makes me look forward more to next steps in growing my role.
That's awesome. You mentioned 100% patient satisfaction score. That is absolutely amazing. Congratulations.
Thank you.
You also talked about support to physicians. Can you expand upon that a little bit more? What type of support do you provide physicians?
For my physicians, I do investigate patient medications. I do not order medications for patients, but I can do proposals of medications, and that makes it easier for the doctors to then just sign off on those meds, speeds things along for them, also speeds along the patient being able to get their refills and their medications in a more timely fashion. I can order testing and things like that and review any orders that the doctor wants and make sure everything's in order and kind of troubleshoot anything like that. Again, it reduces errors and it expedites things for the patient and for the physicians.
Awesome. Thank you. What does your employer do to show that you are valued as a member of the care team? IU Health has just done really good to become fully invested in MA career ladders. For each rung of our ladder, there is a certain set of goals that are set, and you have to strive to meet those goals. And once you have met all those goals, there are certain little pay increases that come along with that. And that is such good incentive for MAs. I mean, really, who doesn't like to get more pay, right? IU Health also values our job satisfaction. They routinely do surveys to find out areas of improvement for our job satisfaction. Then they work along with us to develop action plans, hopefully making for higher job satisfaction and better retention of employees. Most of all, overall knowing that they trust me to take care of things and they value my satisfaction, that is a really great reward. I think all employees really just want to feel valued and like they count. So, you know, just the respect they give is an awesome thing that they give to our care teams. That's awesome. It is definitely, you know, incredibly important to feel valued within the job that you're working at. And everyone does love more money, so I can relate to that as well. Can you tell me, what does a typical day look like for you?
Okay, typically I come in early and kind of help get the office open and get things set up and ready for the day. I peruse my patient list of people who are coming in today and make sure that we have everything that we needed, that all the labs are in, and any outside notes that we need are in so that they're at the doctor's disposal at any time he needs them. I make sure all the rooms are set up and ready. When patients start coming in, things can kind of get a little chaotic at times. I room patients, and here with our EMR, I check everything from their making sure their med list is completely up to date, checking on things like their family history. Do they have any chemical dependent habits, whether it be alcohol or smoking or anything like that? Anything that you might think of involved in their EMR to get it ready for the physician. I turn paperwork over to the physician, and then I also, in that process, I also do all their vital signs and document those. Then I turn it over to the physician, and while he's doing that, I answer messages that are in our pools and kind of sort those messages as, what do they need. If it's something simple as checking on an appointment, I certainly can do that. But if it's some question that the patient has for the physician, I field those questions to the appropriate physician. And then when I get a response back at some point, I call the patient with the response. As our physicians get test results on their patients, they will send me a message letting me know what they want that patient to know about their test results. And so I do all those callbacks and manage all that. I often schedule things like ultrasound, CT scans, MRIs, any kind of testing that needs to be scheduled. I take care of that. It just goes on and on and on, depending on which specialty I'm supporting. Some specialties have procedures, and we assist with those procedures. And if they're a consultative type practice, then it certainly is easier, but it goes on all day.
Wow, that's amazing. I can certainly understand why medical assistants are being called heroes in healthcare. That is awesome. In your clinics, how many medical assistants are there working per each physician?
Usually we have one-on-one, most days. Now, there are the occasional days where we have doctors are out, so we have multiple assistants per physician, and then conversely, there are days where we have staff members who are off for one reason or another, and then we might have to support more than one physician for each medical assistant. So, but we try to keep it on a one-on-one ratio.
Okay, great, thanks. And if someone were to ask you, which is me right now, what's the most meaningful part of your job? What would it be?
The personal satisfaction I get from having helped to grow our clinic and for providing really good care for our patients. We tend to get a lot of good feedback from our patients saying that they, appreciate our quickly helping them with whatever they need. We try to be extremely friendly with them. And, just knowing at the end of the day that we helped our patients do better and we helped our physicians have a more successful clinic, that is just so very satisfying.
That's awesome. What advice do you have for educators who are teaching medical assistants and will soon be working in clinics?
Okay, so I knew what I thought about this, but I also kind of polled some of our physicians to see what they thought and some of our other MAs that have been working for more than 20 years. So we came up with 3 main areas. One thing that I just cannot overstate is how important it is for an MA to have really good communication skills. And to me, that would include written skills, writing things, speaking, listening, and your body language. all those communication skills are just really important. Poor communication really adds to your percentage of errors, and nobody likes errors when you're dealing with patients. Good communication can greatly enhance your experience for patients, for physicians, for your coworkers. It just helps you build better relationships with all of them. The second area we identified was certainly professionalism. It's so very important to be professional. When you go into a job interview and you do not look professional, you just put a huge strike against yourself. It is so important. And even once you're hired, it's so important to be professional when you're dealing with your patients. They want you to be warm and friendly, but they also want you to seem like you know what you're doing. So I just think really good professionalism skills take you a long way towards getting hired, and then also it will help you in advancement of your career. Thirdly, we just think it's important to have really good basic skills, clinical skills. Every practice is going to have things that are a little bit different, or, each thing has something extra that they're going to learn that there is no way that every bit of that could be covered in an MA program. And a lot of that can be taught on the job, but we have to start with really good basic skills. If they don't have that, we're in a world of hurt, because we can only teach so much on the job. We don't have time to teach all the basics, but if they come in with the basics, then we can make them be rock stars.
That's amazing. Thank you for your preparation and answering that question. It did lead me to one last question, which is, when you talk about basic clinical skills, can you expand a little bit upon what you mean? Is that, ability to take blood pressure, for instance?
The ability to take an accurate blood pressure. And not just to do it by electronics. Yes, the world is going, we all rely on our technology, and that's a wonderful thing, but what do you do when your blood pressure machine goes down? You have to be able to know how to manually take a blood pressure and manually be able to take a pulse. Knowing how to take accurate vitals, knowing how to, look at a patient and say, they don't look so good and their blood pressure is not where it should be. I should probably get the doctor instead of making them wait. Just some good basic skills, just kind of knowing what to look for patients, and knowing how to kind of assess that to an MA's ability and who to turn it over to.
That's incredibly helpful. Thank you. So I am going to allow everyone on the phone. I'm going to summarize here. But before I do that, if you have any questions for Leanne or any questions for myself, please make sure you type that in the chat. We're going to be able to have a few minutes to answer those questions. And Leanne, thank you again for your insights. That was incredibly valuable.
Thank you for allowing me to participate.
All right, so I would like to leave you and everyone on the phone with 3 key takeaways. First, keep the dialogue open and find ways to continue to evolve your medical assistance. Second, make sure you are not limiting your candidate pool and include all accredited certification exams in job descriptions. And third, be aware of the trends that impact your medical assistants. So I know that we have a few questions coming in. I will allow, I believe, Stacy to ask the questions, and Leanne or I will be happy to answer them.
Yeah, we do have some questions coming in. And one of the first questions that we have is more about developing those professional skills. And when we have some young MAs coming into the practice, how can we best develop them with just those soft skills?
And does it say whether it's from an educator standpoint or employer standpoint?
I believe it's from an employer standpoint.
Awesome. Well, I think, there are a number of tools out there to help increase soft skills. I'm going to plant a seed for a moment. Stay tuned and aware. In February, NHA will be coming out with a product to help enhance skills and soft skills. But until then, from what I hear from employers, role playing is a really great way to help increase soft skills. And role playing in a sense of not just allowing medical assistants to role play with each other, but also having the physician take time to role play with a medical assistant and give really open and honest feedback in scenarios that are pretty common in the workplace. So I know that is hard to do, but even 5 or 10 minutes, once a week or once every other week will pay off for you in terms of soft skills in the long run.
Great. We have another question for Leanne. This one is a two-parter, Leanne. So the first one is, can you talk a little bit about IU Health, what it stands for? And then the second part of that question is, what types of opportunities have they given you that you feel has been most fulfilling?
Okay, IU Health stands for Indiana University Health, and we have Indiana University Health, which is the hospital side, and we have Indiana University Health Physicians, which is more of our clinical side, so doctors' offices and things like that. As far as what they have done for me, providing the opportunity to become certified has been major. I was out of school for between 25 and 30 years, and back when I took my program, there was no thought of being certified. They didn't encourage it. They basically said it was a waste of time, and you'll never need it. So that held true for a number of years. Until recently, and then IU did put in the career ladder, and as part of that, they do provide excellent opportunity to be certified through the NHA. They allow us time on the clock to study while we're at work, and they support that. They pay for our certification the first time round. They support us in so many ways. You would not believe how supportive they are of that. And that meant a lot for me. I was so nervous about doing it. After having been out of school that long, oh my goodness, I was really concerned about being able to do it and to pass, and IU Health just was amazing in their support, and I was able to pass it the very first time with a really good score that I could be very proud of, and just them investing that in me meant a lot. And then, as I had said before, we do have steps on the ladder that you can climb, and each one of those steps comes with, not only just recognition, which they're very, very good at, but it also does come with some financial remuneration. And like I said, everybody likes more money.
Very true. We have another question from a program manager who's looking to transform medical assistants to the patient navigator role. And this question is for both Crystal and Leanne. What do you see being the biggest barrier in that transformation?
I can go ahead and answer this. So I have to start by saying I'm not a subject matter expert in terms of patient navigator, but as I've been in the industry and have attended a number of different conferences, I think the first thing that I've seen as the biggest challenge is that there's not it can be called different things. So there's patient navigator, for instance, or some people are calling patient navigators health coaches. So I think it's defining on what that role is and what it isn't, and being aware of what it's called throughout the United States. And then from there, identifying what are those core competencies related to that, quote, patient navigator role that you should teach on. So I think, again, in summary, what I've heard is the biggest hurdle is just not really knowing the national competencies and what they are called throughout the United States.
Leanne, do you want to add to that or have
I really can't add a lot to that. We don't really have that role so much here with my employer. So I really can't really identify with that or can't really add to that.
All right, well, thank you for that. Let's talk a little bit about motivating younger MAs to take initiative to do to do more than what's just in front of them. There's a couple questions really kind of getting at the same thing here. So how can we motivate those younger MAs to do things beyond the job description to take care of their patients from a professionalism and a soft skills initiative?
Yeah, so, the idea of motivation, I think, even outside of just healthcare alone, it goes back to the core of humans of feeling valued as a member of a team. So my response to that would be, if you are creating a career ladder, if you are telling them they are valued, if you are showing them a path to, better themselves, that in turn should motivate an individual to want to do more outside of just, this is my job and I'm doing it somewhat okay right now. So, showing the value to the team is probably the first step I would take in trying to address that challenge.
Can I add to that?
Absolutely.
Okay, so we're at IU Health Physicians. We have MDI boards in all of our clinics, and it's not unusual for us to, write, hey, good job, so-and-so. We have WOW cards that can be filled out by either patient or staff. And I know when we have new MAs that are not so very experienced or maybe have kind of struggled with a few things, as we see them make improvements, we'll write a WOW card for them. Then at our meeting time that we have for our team, those cards are read out for everyone to hear. And it's a source of pride for them. Costs nothing for the clinic, but it's an awesome thing. Everybody likes an attaboy or an attagirl when it's appropriate. And that really, I think, helps. Just having good support for them with a more senior MA in the clinic or on your staff can also be helpful, just to kind of lead them along and to give them a sense of pride. And I think that as they build pride with patient satisfaction and with other little, just recognition that they're doing a good job or that they're learning or that they're coming along, that inspires them to want to do better.
That's a great addition. Thank you so much.
We have time for just a few more questions. One of them, Leanne, can you tell us what an MDR board is?
MDI board it's part of our lean process that we have. It's management for daily improvement. And on it, we have different areas that, we set goals for our clinic. Maybe it's a weekly goal or a monthly goal or a daily goal. We have different areas for each of those. And we set our goals, and then we have an area that they are measurable goals, so we can see where we're at with those goals. And then we have an area that we just kind of save just for more fun stuff. Okay, so it's like happy birthday or congratulations on, whatever, kind of more personal stuff. And it also, we have an area that if we can put up there an assignment of what MAs are working with what physicians that day, it makes it easy for everyone to be able to glance at that board and tell who is responsible for what. So it eliminates a lot of the confusion of, well, this person usually takes care of that physician, but today they're taking care of this one. But, it just eliminates a lot of confusion. And it's part of our lean process. It's an MDI board.
Great. Another question, maybe for Crystal, what is the average pay of a certified medical assistant?
Yeah, so we know by research that medical assistants who are certified often earn more than those who are non-certified. The best data I have is inclusive of both buckets, so certified and non-certified. According to the Bureau of Labor Statistics, at last glance, I believe the median income is about $33,000 on an annual basis.
It does not look like we are getting any additional questions into the chat. Actually, we do have one more question that just came in, or maybe two more questions that just came in. So let's talk a little bit about externship placement. So it definitely tends to be a pain point or a cumbersome piece of MA programs. What are you hearing about motivational interviewing or health coaching skills? Can those help students get placed in externships?
So one of the biggest challenges I hear as I speak to employers about externships is their ability to interact with the patient. And so when for instance, a medical assistant program is in the didactic portion of their program, what I've experienced are those programs that are teaching motivational interviewing skills and health coaching, they have to have role plays if they're teaching those topics. Those students tend to be more prepared for the clinic simply because they are doing pretty intense role plays in the classroom.
Great. We have another question. You mentioned advisory boards. Can you go over again what this process looks like? Who do you contact? What should these meetings entail? How often when you're trying to set up some advisory boards with your area employers?
Yeah, so that is a multi-point question. I'll start with who do you contact? So the first point of contact, if you're in an educational institution trying to get feedback from employers, is anyone who manages the externship sites. Those are definitely individuals who can provide feedback, as well as recruiters. The best way you could do that, if you're partnered with NHA, we can help, depending on the employer, connect you with the right people. But it's also, I would say, an opportunity for you to just call your contacts, ask them if they have the contact information for externship coordinators or recruiters, and that would definitely be a great starting point. The second question is, who do we contact? So I answered that, but what should these meetings entail and how often? The meeting should really be framed up in a way that allows an open dialogue. Come prepared as an educational institution to ask the employers open-ended questions and encourage honest feedback. It's really easy to hear that, when the students graduating the program tend to be doing really well, but there's always going to be opportunity to improve. So again, if you're partnered with an NHA, we have a list of great questions. Contact your certification specialist and they can get you a list of open-ended questions that you can use at your advisory boards.
Great. We have time for about 2 to 3 more questions. Does anyone have any other questions for Leanne? Oh, here we go. It was like magic. Leanne, can you elaborate on what the basic skills should be that an MA comes into the office with?
Their basic skills are they need to be able to be very good at taking vital signs, both manually and electronically. That's one thing. There are other, things like autoclave, basic sanitation, cleaning rooms and getting them prepared. Anything that would involve rooming a patient and getting them ready. We don't expect that they're going to come in and, know by looking at someone's labs, oh, this is exactly what they need. We don't expect that. It's nice for them to have some general knowledge of that, but we expect that they would have some basic, good skills, finger sticks for blood, phlebotomy, things like that. Those are things that they need to have before they come to us. We recently had some externs in our office. One of them had very, very good skills and very good communication, and the other one was the polar opposite. And, you know, the difference in them was just absolutely night and day. And I really feel like moving forward in their careers, there's going to be a huge difference too. During their extern program, there is only so much time that we can teach them. We do want to teach them, and we do want them to leave success and be successful. However, our practice still has to be able to go on, and we have to stay on time, and we have to provide what we need for the doctor and the patient. So those basic things, vitals, anything for rooming a patient, doing finger sticks, phlebotomy, anything like that, those are what I would consider basic skills that is just imperative that they would have.
Great. One more for you, Leanne. Talking a little bit about, do you attend any national conferences that support MAs? And if so, does your institution support that, or how does that work?
They have not to date allowed that or paid for that. I'm sure that if we wanted to use our PTO time and to go to a conference, they wouldn't say, oh, no, you absolutely cannot do that. But I have not heard of them financially supporting that.
All right. Well, I think all the questions that I am seeing coming into the chat. If there is something that you would like answered that you feel like we missed, if you wouldn't mind reaching out to your certification specialist, and they can be of much help to you. The other thing that I want to mention is we have seen some comments in the chat that people are really interested in learning more about NHA's health coaching product and our soft skills product that Crystal mentioned coming in early February. If you wouldn't mind just giving us a note in the chat so we can follow up with you, that would be really helpful for us. And that way we can also give you a little bit more information as it becomes available. We don't want to miss the opportunity to help you. And with that, I think we are going to go ahead and wrap up. Thank you so much, everyone, for giving up your time and joining us today. We hope that this was beneficial. You will be receiving an email as long as you registered for the webinar that will share the resources that we talked about today, which you'll get the webinar slides, you will get the recording of the webinar, and then you'll also get the career laddering poster that we shared with you that really hopefully you can pass along to your coworkers and colleagues as well. So again, thank you so much for joining us today, and we hope that we will talk with you all soon. Thank you.